Cosmetic surgery. It's one of the fastest growing and most innovative fields in medicine today. Doctors are constantly improving techniques and procedures to ensure the best possible results for their patients. On Cosmetic Surgery Today, with Dr. Barry Allen Leica, you don't have to navigate this on your own. He'll guide you through what's new and what to look for, help set your expectations, and deliver everything you need to know in an easy-to-understand format, including how to market your business. Here's Dr. Leica.
It is my utmost pleasure to announce and introduce Dr. Bruce Katz, who is a board-certified dermatological surgeon based in New York City. In his 30 years of practice, he's been recognized as a leader and innovator in the field of dermatology for his advancements in the use of laser skin rejuvenation technology, contouring treatments, and more. As director of Juva Skin and Laser Center, he offers his patients a broad selection of procedures, both medical and cosmetic, to help them look and feel their best. Some of the most popular options include new cellulite treatments, Smartlipo, Emsculpt, Bodytite, and injectables like Botox and dermal fillers. He is often featured as a medical expert on television segments, most notably The Today Show, Good Morning America, CBS New York, and CNN, and traditional media outlets like Cosmopolitan and industry publications such as Dermatology Times and the Journal of Clinical and Aesthetic Dermatology. Bruce Katz is a regular guest lecturer at medical conferences where I've shared the podium with him, including the Las Vegas Cosmetic Surgery Annual Meeting. In addition to maintaining his thriving practice, Dr. Katz keeps busy by conducting research and clinical studies through his nonprofit organization, the Juva Foundation Research Center. Hi, Bruce. How are you today?
Thank you very much, Barry. Very kind of you.
Very good. Thank you. Well, let's talk today a little bit about cellulite. I'm going to start with a very tough question. What is cellulite, Bruce?
Well, Barry, that's one of sort of the holy grails of body contouring in our field. But I think the consensus today is that cellulite really is caused by three structural issues in the skin and fat layer. First of all, we have these fibrous bands that pull down on the skin. And the fibrous bands basically connect the skin to the underlying fascia. So that's a surface of skin, and then we have the fat layer, and then the fascia, which covers the muscle. So the fibrous bands connect the skin to the fascia. If for some reason they start to stiffen up and pull down on the skin, they start causing those dimples. And then we have the second issue, which is what's called fat herniation, the fat pushing up at the skin, and that causes the raised areas. Because as we know, cellulite is sort of this mattress-like change in the skin. You have hills and valleys. So the valleys are caused by the fibrous bands causing the dimples, and the hills are caused by the fat pushing up and causing the raised areas. Finally, the third issue is the laxity of the dermis, and that's part of the skin at the bottom of the skin. And when it becomes really lax, it allows both of those things to happen. It allows the dimples to occur and allows the raised areas to occur. So I think today we understand that there are three issues that contribute to cellulite.
Yeah, and to keep it simple, I like people to think of the cellulite component as an overstuffed mattress. You've got 2 pounds of fat in a 1 pound bag, so it's literally herniating everywhere. It's pushing everywhere. The mattress has gotten a bit older, so it's not as tight as it used to be, and those bands that are there cause the dimpling that's there. So it's like a bit like an overstuffed mattress. Would that be correct to say so?
Absolutely, Barry. It's a great analogy.
Good. So, cellulite has been treated forever. Since you and I were knee-high to a bullfrog, you and I, when we were medical students, they talked about cellulite. But cellulite treatments have gotten a lot better over the years, and I think that's what we need to emphasize here. We now have treatments that actually work and treatments that are uniform across many platforms. So let's go into some of the older treatments and some of the newer treatments.
Well, some of the older treatments include creams, topical agents such as caffeine or theophylline, aminophylline, and those really didn't do very much. You had different types of suction devices, radio frequency devices, laser devices that would sort of create temporary improvements in the skin, procedures such as vellus shape or acoustic wave. These worked to a certain extent, but you needed multiple sessions, usually 8 or 10 treatments, and the results were not long-lasting. You'd have to do maintenance treatments. Most recently, the one treatment that really, I think, had really a big effect on cellulite was a laser treatment called Cellulase. And we actually pioneered that treatment about 8 or 9 years ago. And basically, this is a minimally invasive treatment. We create incisions in the skin, and we use a laser that goes under the skin and basically addresses those 3 structural changes that cause cellulite. It cuts those fibrous bands, it melts the fat that's pushing up on the skin, and it stimulates collagen to tighten the skin. So that's Cellulase, but that's a minimally invasive procedure. There's also another treatment called Selfina, and that's what's called a suction-assisted device, which really creates what's called subcision. And it's basically a blade that goes under the skin and cuts the fibrous bands, similar to Cellulase, but it doesn't really address the other 2 issues. So that really only treats dimples. Finally, we have the most recent one, and I think the most effective in terms of convenience, ease of use, very quick results. That's called QWO, QWO, and that is basically an enzyme called collagenase Clostridium histolyticum. And that is an injection. And I did the FDA trials for that as well, and we basically inject these dimples, and it dissolves the fibrous bands so that the skin is released and the dimples go away and the skin gets back to normal.
Well, that sounds fascinating, and that sounds like it would be a solution to a lot of the problem we have there. I remember when we used to use a technique called LipoDissolve, which consists of phosphatidylcholine and sodium deoxycholate, which helped to emulsify some of the fat that was in those areas. So although it would treat part of the problem, it wouldn't treat the band problem. But it was very useful for some of the smaller areas of cellulite that we had. And it did require less treatment than our cellulase lasers.
Well, that's true, Barry. And I think it's sort of like, phosphatidylcholine 2.0, put it that way. It's an injection like phosphatidylcholine, but it's a different chemical. And the nice thing about it is that it really is very precise in addressing just the fibrous bands, because it attacks collagen 1 and collagen 3 is what the fibrous bands consist of. So it doesn't damage surrounding skin, it doesn't damage blood vessels or nerves. So it's very targeted. Basically, we do 3 treatments. We separate them by 3 weeks. So we do 1 session, wait 3 weeks, then do a second one, wait another 3 weeks, and then do the third one. It's easily tolerated. We use tiny needles, so women hardly feel it. I think I did 4 treatments yesterday, and my patients were, talking to me, reading emails, listening to music. So it's really quite comfortable. And the only side effect is that you get bruising. And the bruising goes away in a week or 2, but we haven't seen any other side effects. But most interestingly is we did the FDA trials about 2.5 years ago. So I called these women, each one individually, who we did the trials with 2.5 years ago, who had the active medicine. I asked them, is the cellulite still gone or has it come back? You know what they said? Cellulite is still gone. So we know this is a long-lasting result, a long-lasting treatment. So we finally have, I think, the Holy Grail.
That's nice. That's nice. And it's nice to have something that's less invasive than the Cellulase treatment. Cellulase was a wonderful laser for doing this, but it was time consuming. It would take 2.5, 3 hours to do a treatment session. At the same time, it was fairly invasive. So people weren't up and around right away. They were bruised. They were tender for at least a week afterwards. And it was much more invasive than I thought it would be.
Well, also, Barry, what you say is absolutely true, but also it was a high learning curve. There are a lot of components to doing cellulase, and I think a lot of doctors tried it and, having wanting to get through the procedure as quickly as possible, sometimes they missed a few steps. And if you don't do every single step properly when you're doing the laser treatment, you don't get the results. So that's why I think a lot of doctors really didn't get into it. But also, like you say, it's an invasive procedure. It requires local anesthesia. You have to operate a laser beam that shoots in 3 different directions. So you have to know how to, direct the laser beam under the skin blindly, essentially. And, it takes a lot of experience to get good at it. But it did work. And, we had long-lasting results from Cellulase. And I've seen patients who we did treatments 8 or 9 years ago, say on the back of their thighs, and, they were so happy with the results, they came back more recently and wanted the front of their thighs done or their butt done. So, we know it did last, and it's still popular. I did a Cellulase treatment 2 days ago.
And that just shows that a procedure that's been around for 8 years is still there, has shown that it's been useful.
Mm-hmm, absolutely. It's a little rough on my arm, though. It's a lot of work. So I'm very happy that Quo has come along, and all it does require is an injection.
Yes, it's nice because as we get older, some of these older treatments are a bit taxing. Liposuction is a fantastic procedure, but our joints start to wear out as we do the procedure. Our shoulders, our knees, our arms, it just all start to wear out.
Tell me about it, Barry. I know it well.
It's unfortunate, but it's true.
True indeed. True indeed.
So who should a person look for their liposuction, for their LipoDissolve treatments, for their Quo treatments, Bruce?
Well, that's an important question, Barry. I mean, I think anytime you go in for a cosmetic procedure, whether it's lipo, LipoDissolve, Smartlipo, Quo, you really want to go to a dermatologist or plastic surgeon who knows the skin, has surgical experience, hasn't just picked this up on a weekend course, which unfortunately a lot of other specialties have been doing recently. And you want to make sure they have experience. They've done a lot of treatments on patients similar to you. And you want to see their before and after photos. And don't just rely on, some doctors will just give you a brochure, which is supplied by the company, and obviously isn't a reflection of their own work. You want to see their own photos, their own, patients, and see the results that they've been getting. And, make sure they've been doing this for at least a few years and doing a lot of cases. So you're not the one they're experimenting on and trying to learn the procedure on.
Yeah, I think that's important. Experience counts and experience matters. So I think that's something that people should look for, is the experience in every case that they're looking for.
Absolutely. And, today, unfortunately, with the insurance situation, a lot of doctors from what we call the non-core specialties are coming into the cosmetic surgery field. They want to get into cosmetics because there's no insurance involved. It's self-pay. It's elective and cosmetic. And unfortunately, a lot of them are not very well trained. And, I see often bad results from other doctors or med spas that have gone and learned these procedures overnight. I think they're experts at it. And then we have to try to correct their problems that they cause by their lack of experience.
Yes, the fact is it's a lot of small details that make the really good results.
Oh, yeah. And, patient selection is really important, knowing, that a patient coming in is the right, candidate for, say, cellulite treatment. Some women come in and they think they have cellulite when it's really loose skin, and that's causing the dimples. So you have to differentiate what's real cellulite from just loose skin that's causing redraping and looks like cellulite. Also, people coming in and they have areas that may have indentations. They could be scars from previous liposuction and may not be cellulite. So you really need to, select patients properly, make sure they're the right candidates, and then also, use the right technology on them so they can get the optimal results.
Yes, and I think that's what the end results are is most important, is the optimal results. Everybody wants to have good results, but you got to let the buyer beware, Bruce.
Oh, yeah, absolutely. That's
okay.
True.
Well, thank you, Bruce, for being here today. We'll be going on to a next show in just a minute for you. And thank you again for sharing your wisdom on cellulite.
My pleasure, Barry. Great to be with you.
Thanks for joining us today on Cosmetic Surgery Today. It's a beautiful day to explore your options, and we know you'll want to grab your free copy of Dr. Leica's book, Shaping a New Image. All you have to do is drop an email to tammy@leica.ca. That's TAMI at Leica, LYCKA.ca. Tammy at Leica.ca, and we'll get you a digital copy of this fantastic book, chock full of information. See you next week on Cosmetic Surgery Today.